Thank you to everyone. As mentioned, I'm a full-service family doctor in Vancouver. As mentioned in previous talk, I'm also a human. And I really want to thank all the organizers for inviting me. I want to thank all of you who have braved the rain here, to the 247 people who woke up to log on. Hopefully they're still awake. Today, even though I'm talking about technology in the context of healthcare, I'm intentionally going lo-fi, and I don't have any slides, I don't have any videos to show you. A few weeks ago I gave a presentation on medical tourism, and my co-presenter was teleconferencing in from Harvard. Apparently he felt that having lunch later on that day with a Supreme Court judge was more important than flying to Vancouver to be with me, but so is life. And I thought to myself, as we were setting up, with so many moving parts on Saturday morning, this was a recipe for disaster. It turned out that it was okay, but I thought, you know what, I can only push my luck so much. And so today I'm purposefully just going to make this as low-tech as possible. And I think that what that speaks to is the fact that there are different needs for different situations. And one of the things I'm really happy that I'm hearing is that the goal of all of this is not equality, because everyone is different. We all have different strengths. We all have different needs. There are different barriers that we have. Sometimes it may be geography, which is why some people may be more comfortable coming in via Twitter or coming in video teleconferencing. Some of us may have physical challenges. Some of us may have emotional barriers that affect our access to healthcare. And so what I want us to focus on is that even though when we speak about studies, when we read things online, we may hear things talking about the average person, no person is average. And I really want you to come away with that message today. And that really what we're moving into is this idea of personalized healthcare. And I don't necessarily mean we're talking about genomics and saying that we're going to analyze your DNA and figure out what's going to be the best for you, because that may be coming sooner rather than later, but really thinking about each individual person and what is it that they need at this time. And so when we start thinking about that, we get into bringing in the resources of things like patient advocacy groups, things like using technology like Twitter to have tweet chats that have happened online. For example, there was one a few weeks ago with people who had multiple myeloma, a group of doctors and 36 people with multiple myeloma who got online from all over the world and talked about it. And being able to break down those barriers so that anyone can really connect almost at any time. And so what I want to talk to you today about is one of the technologies that I've been using with really great effects, which is a video teleconferencing platform. And the one that I've been using is one called Medeo, M-E-D-E-O. It's accessible at medeo.ca, and it is free. It's currently supported by the British Columbia Ministry of Health in cooperation with the British Columbia Medical Association, and that there are fees so that when you log on, your healthcare provider can actually be paid for talking to you. So it's completely free to use, and when you log on, all you need is a Wi-Fi connection and presumably a safe, secure place. You can have your phone, a tablet, a laptop, a desktop computer, and you're able to access someone. And this is great because for a lot of people, as we mentioned, there are those barriers. So I have people who have spinal cord injuries, and for them to come into my office, they have to get into a specialized van, and they have to come in. And my office isn't set up for wheelchairs that are this wide. And then they're coming in and they're exposing themselves to other people in my office who are sneezing and maybe infectious vectors for them, not to mention the magazines that we're trying our best to get rid of, although apparently some patients come and actually drop off their old magazines in our office. So, so again, and all of this for a visit where I may not need to physically touch the person. And I'm not saying that this is going to be the new standard of care and that no one ever needs to see a physical human being again. But just to say, a lot of times, if we're going to talk about how are you doing? How's your level of comfort? How's your mobility? How are your bowels? How's your blood pressure? These are things that we don't necessarily need to be in the same physical space to do. And in fact, demanding that someone come in to see us may actually be a harm and a barrier to access. So by having this technology, it's fantastic because I can say to someone who has a spinal cord injury or mobility issues where I'm worried about pressure wounds, can you have your caregiver take the phone and just move it around the body? And let's put it on your buttocks, and let's put it on your hip, and let's put it on your ankles, and let's see how everything is healing up. And I'm able to say, okay, it looks like we're now at a stage 1. Here's what we're going to do. Or it sounds like the bowels are moving well. here's what we're going to do. It sounds like your blood pressure is under control. Here's what we're going to do. And I can send them prescriptions. I can send them requisitions for lab tests. About 100 patients a day are currently signing up, and the feedback is very positive. In all of the interactions, there's never been a single negative comment. There's never been someone who said, I did not enjoy using this. There are people who have offered feedback on how this can be better, and that's perfect. That's what any platform hopes to have. But no one has ever said, I didn't enjoy using this today. It's very intuitive, and every visit is supported by a coordinator. So for things like rheumatoid arthritis, which is our focus today, we know that things like fine motor skills can be affected. And anything that demands a lot of typing, a lot of movement, is going to be difficult. But in a teleconference situation, typing really isn't needed. All that someone needs to do is log on or have someone log on or have predictive text, and then a coordinator who's sort of like the medical office secretary comes on, says, how can we help you? And we know that over half of the visits are between people and their normal doctor. That is to say, these are supporting the continuous relationships that you have with your doctors. We're supporting longitudinal care because we know from studies of Barbara Starfield and others that when you have a continuous relationship with a family doctor or with a medical specialist, that your care is better. Your care is more efficient. You have better outcomes, quality, quantity of life, fewer admissions to the emergency room and the hospital. And so this technology is supporting access, because once we start taking out someone having to physically go to an office, well, now all of a sudden you can access your doctor at 8 o'clock on a Thursday night, or maybe 12:14 on a Saturday morning, because perhaps your doctor has their own obligations that they have to meet. Perhaps they have children that they have to pick up at 3 o'clock, and they're probably not going to go back to the office. But once those kids are napping or doing their homework, there's no reason that your doctor can't be available to see you online. And I've had instances like that where patients with mobility issues due to arthritis, spinal cord injuries, perhaps they have an acute illness that prevents them from coming in. I've had people who are traveling where they said, I'm in Fort St. John and I'm not sure where to go for care, and I don't know anyone here and no one here knows me, but you know me. And so we can hit the ground running and provide that continuous care. The technology is secure. It's born and bred in British Columbia. The servers are in Kamloops, in the same place where the British Columbia government's servers are. So for any of you worried about the NSA and worried about the reports of Skype opening up their doors and telling the NSA if they can come in and take any information they want, this is all local. This is a BC technology that's there. So I think probably the best thing at this point is to open up the floor to any questions about this. But what I do want to say is that these types of technologies where we're really getting into the age of personalized medicine, where we're allowing you to say, here's how I want to access care. And certain times I'll need to come in to see someone, and certain times I won't need that. So the best thing for you to do is to try it out. Go to websites like Medeo. Sign up. It's free. There's nothing to lose. Try it out. Secret shopper it. See how it goes. Tell your doctors, hey, if I can't make it in or I need to ask you a question, will you be there? Is there a way that I can reach you? And how can we organize that? Can I send you a text or an email to get in touch with you and organize a visit? And will you sign up for it? To talk to your caregivers and ask them to sign up, to talk to your supports and your care providers, to let them know about it, and certainly to let your elected representatives know that there's fantastic technology coming out of British Columbia that's really encouraging the longitudinal continuous health relationships between you and your care providers with technology that is from British Columbia, that is safe and secure, and is leading to better and more efficient health care for you. Thank you very much.